Welcome to the Pharmacist RN, a podcast made for pharmacists by pharmacists. Pull up a seat and let's get started.
Welcome, everyone, for another episode of the Pharmacists RN podcast. My name is Ajit Johal, and I'm joined by my co-host, Dr. John Papastergiou from Ontario. So, John, we typically, and we were discussing this earlier, we have a lot of therapeutic topics on our podcast, which is big appeal to our listener base, clinical updates. But recently, we've been having some pharmacy political discussions. So, we were at Pharmacy in Toronto streaming live, and we had Justin Bates and Hitesh Pandya from OPA. And then recently we had Deepak Narang from Alberta. He was running for ACP, and he was talking about some of the things that he was standing for members and the profession, and he was on recently as well. And I think he had a great experience on the podcast, John, but he likely got a bit more out of it than he thought he would, right?
Yeah, it looks like I just found out that he won. So it's like it's like we're Joe Rogan here. We're shaping elections across the country.
But we're pro-vaccine, though. I just wanted to.
Yeah, that's right. We're pro-vaccine, but as it's opened up. I think our audience to some listeners that may not be so into the therapeutic topics, but have an interest in advocacy and what's going on in the profession. And there's a whole group of people, obviously, that are helping to move the profession forward. I've always thought of Smita as one of those people. I've known you for a long time. Welcome to the podcast. We've had a chance to travel to conferences together over the years. Right. Your career's taken some interesting shifts over the last few years that the time that I've known you. So maybe we start with that and just tell us a little bit about your career and then we'll go from there.
Absolutely. Thank you. And thank you for this opportunity, guys. It looks like you guys are a lucky charm for people running for elections, huh? So, I mean, all kidding aside, yes, John, you're absolutely right. My career path of about 22 years has taken all kinds of twists and turns. But, I'm a pharmacist at heart, and that's where my story begins. Have been in the practicing environment for about 22 years right now. And it's taken me right from being a full-time pharmacist in the pharmacy to, leading a group of pharmacies as a director of operations and led pharmacy services team, went to government affairs for a bit, and then kind of did the whole loop and came back to, supporting independent pharmacy owners in the professional affairs team. So right now I work as, on the professional affairs team with a national scope. So which I consider myself very privileged to know coast to coast what's happening in the practice. And very close to that is also the sustainability of our business. And that's where I am right now. And I think we will have more conversations around what my plan is. But yeah, that's who I am.
Yeah, and it's interesting how pharmacies opened up, kind of the ecosystem for pharmacists has opened up, and pharmacists are doing great things in so many different areas. When I think of kind of OPA and the role it plays, how do you think you could add value to that or help shape kind of the direction of their kind of governance plans?
That's a very interesting question. And, what I see OPA in particular, and most of the associations, provincial associations across the country, what they do is lend that lens of not just the practice, but also how the pharmacy as a profession supports the communities that they work, that they are in, right? So a lot of the pharmacists, they take care of the community. So I think we have come a long way. We are a very trusted profession, and we are the first point of access in a lot of cases. The way I look at advocacy and what I bring to the table to OPA if I'm elected is to bring that system-wide experience, and also help connect dots as it relates to, I mean, the biggest challenge we have in our profession is not caring for the patient, but more the interoperability of all the systems that we work within. I think that's something that we need to continue to advocate for. And the other piece I touched upon was the sustainability. Like pharmacists are the first professionals to raise their hand to do anything and everything. They are very resilient, they're very adaptable. We have seen through COVID, we have always stepped up to do more for our communities. But I think the conversation around the sustainability of the profession is always a kind of a conversation that let us have it later kind of conversation. So we need to have that conversation along with talks about the scope expansion. It's one thing to do it, but if you can't afford to continue to do it in the pharmacy, the people are the ones that is being impacted, right? I mean, it's very timely we are having this conversation. Just this morning, Ontario Government Ministry of Health announced that pharmacists can administer 6 additional publicly funded vaccine. And I think we are going to see more of the common ailments list growing. And I believe we can continue to do that if we are sustainable as a profession, right? So I think that's where OPA does a lot of great work, and I think we need to support. And I'm a big proponent of we need to be members of our association to make that voice even louder so that we can actually get things done.
No, that's a really good point. So it's definitely, and I've known you in your role with RBG and know you do a lot of work nationally. I hate to admit it, but Ontario often is considered the center of the universe, as John likes to think so. And there's a lot happening in pharmacy in Ontario, and I mean it's the most populous province.
Yeah.
So pharmacist services that are implemented in Canada, if they are done in Ontario, it's going to impact a lot of people.
Yeah.
Scope tends to lag behind.
Yeah, that's true.
So it's great to see they're slowly making it in. But your point about implementation is just so important because as someone who's always adopted clinical services, it's a lot, you can make an announcement and kind of say, yes, pharmacists can do this, but even like what the public understands what they can access and what they can't. And then of course, workflow, capacity, human resources, all of that takes time. And if there's going to be more publicly funded immunizations, because I'm going to talk about immunizations because I love immunizations, is you're going to need additional capacity for administration. There's going to be cold chain considerations for everything. So all of that needs to be considered. So it's perfect timing for this scope expansion because of the election. I think that's a critical direction to have the advocacy body steer that ship.
Yeah. And I know you did mention about the implementation piece. I think that's why for me it is very crucial that we have conversation, not just the scope expansion, but at the same time funding go hand in hand. You can't have one conversation and then come back and then have another conversation, right? It has to go hand in hand. Otherwise, that's where you see our pharmacists lagging behind in adopting some of those scopes, is just because it is not possible. If you're not funded appropriately, you just can't make it work in the pharmacy. And a lot of the things that we do is we see what happens at the policy level. But again, going back to John's question about what I bring to the table is I see that policy come alive in pharmacy. I am a practicing pharmacist in addition to my role as an advocate for our independent owners. I see some of those gaps that we have to close those gaps, right? Otherwise, it is not going to be successful. And we are not going to see the outcomes that the government is looking forward to. They want to see outcomes in the public. And if you tie our hands by just giving us a scope, but not the funding to support us, then we are not going to be able to do it in the pharmacy. So you can give me as many scopes as you want, but I can't implement it in the pharmacy. So
that's a great point. So the other thing, Smita, is you mentioned that you still do practice despite your extensive work in policy, advocacy, and professional practice. And I thought that was really interesting because a lot of that is on your own volition to kind of see from the front line how this permeates through, which I think is so important because I mean even when I do presentations about different vaccine and different ideas for pharmacists, it's the execution or even the failed execution of that often gives learning
And
lessons.
and I believe in you can't advocate in an office, right? You can only advocate when you see whether something is going right or wrong. And for me, that is very important. I mean, I believe that's one of my values. I want to make sure that when I advocate for something, I know actually what's happening on the front line. Otherwise, I'm just talking a lot of words and it's not making any sense, right? And I think that's why I also love when I get an opportunity, when I speak to government officials, I can speak from that experience, that lived experience. I'm not reading out of something. I have lived it, and I can represent my peers appropriately when I get that opportunity. And I consider myself that kind of, a pragmatic voice who kind of represents our peers who, I mean, all of us can be in front of the government officials. So when I get an opportunity, I make sure I speak on their behalf as well.
Smita, when I think of Ontario, and then you already kind of touched on this a little bit, we're a big province, we've got so many different viewpoints. One of the challenges for OPA in the past, I think, is coming with kind of one aligned message. And I know internally there's always debates. Do we go for a fee increase in Ontario because we haven't really seen one in years and years, and the cost of dispensing continues to go up, or do we focus on expanded scope with reimbursement? And you touched on that, and I know sometimes depending where you work, your opinion varies, right? And I think from your perspective, what's the right approach here? Do we continue to ask for scope, make sure it's reimbursed? Do we do a fee increase? Do we do a combination of both? But we are underfunded here, and you see it. You touched upon it. If you work, anyone working in a pharmacy, those pharmacists are being pulled in a million different directions, and they're choosing tasks sometimes depending on the funding, right?
Yeah. Well, it's a very important question, John. And I think Justin Bates would be the best person to respond to this appropriately. But I can say that from having experienced so many years being a pharmacist and seeing our profession and our business evolve, I would say that it's very difficult to answer the question as to let's go fight for a fee versus fight for scope. It has to go hand in hand. And I think we need to stop talking about pharmacy sustainability just from a business standpoint, but from a system standpoint. So, as an example, when we talk to the government officials, it has to always be from the perspective of the community, of the public. So, if you want us to successfully manage the health of our communities, we need to be there. We need to have open doors. And we can't have, 50-cent increase every 10 years, if that, and then say we have to manage the inflation. The other piece that we didn't talk about is the human resource challenges that we are having, right? There's a shortage of workforce. So I look at it as a holistic problem rather than let's go for a fee versus a scope. You can give me scope, but our funding has to be the main discussion because we help drive economy of the province and of the country, as well as we support affordability, right? And I think those two are some of the strategic pillars for the government, whether it's federal or provincial. Everything they talk about is affordability and economy and healthcare. Because we are in that space, for us that becomes like a underlying of everything we do and support those two mandates for the government. So I think it's a big discussion, it's a holistic discussion rather than line items.
Well, that's a really good point, Smita. I had a question for you, more so about your motivation to take on the OPA role. So it's obviously there's effort that's going to come in terms of campaigning and trying to get the word out. And then once one is elected, and again, just speaking from experience in advocacy board positions, it's it is a thankless job, right? Because I mean, as Justin Bates said in our previous episode, there is a long game to this, and obviously that long game is accelerating given the crisis in primary care. But there's obviously going to be pharmacists that are going to say advocate for this, don't advocate for that. And do you see motivating you to take to put yourself forward for this position, do you see there's a huge opportunity? Like, are we at an inflection point here where we could see change faster than we did, say, 10 years ago?
I would like to say yes, because I think we have seen more change in the recent few years than we have seen. I mean, I've been practicing for 22 years to be exact. I have not seen so much change happen within the last 3, 4 years. So that makes me very optimistic about the change that can potentially happen in the upcoming years. So it could be fast and furious where we are sitting. And part of the motivation for me as well is I have reached that point, and I totally agree. Advocacy overall is a thankless job, but there is a feeling of fulfillment when you see small changes happen, the needle moving ever so slowly. More people talk about, advocacy. The best thing I've seen in my own organization is the grassroots advocacy, how we are able to empower our owners and pharmacists to speak, to tell their story, because nothing is better than you telling your own story. We can all, talk a lot of talks, but when someone who has lived that goes and talks to the government saying, this is what's happening and this is how I support my community, that lands very differently. So I think that's one of the things that motivates me. And we say that profession of pharmacy is the most trusted. People like to come and talk to us all the time because they don't need to necessarily have an appointment. They can just walk into the doors and talk to someone in the pharmacy, right? I think we should see that as a positive, and that is something that hasn't changed for a long time. So that will help us continue to advocate. And it's all about educating our patients as well. They are our best advocates. We can not only advocate on our behalf, we should also get the patients along with us so that they can advocate. I mean, imagine lack of sustainability could lead to pharmacy closures. That would directly impact patients in certain communities, right? I mean, we are all lucky to be living in, metro cities where we have a lot of pharmacies. But as you go more into the rural areas, you don't see that many. One pharmacy could be it in terms of healthcare access points. So I think that is one of the reasons that keeps me motivated. And I just love my profession. And I feel I've gotten to a point where it's time to give back. Right. And what best way to give back that will impact all is by doing advocacy work for the profession.
So Smita, remind us of the process. So I think there's two positions that are available right now.
Yeah, there are 2 seats available.
And OPA members will get an email. So then there's a window of time they get to vote, I think.
Yeah. So the voting, there are 2 seats, and I'm up against some really hard hitters. I have to say, my peers are really strong, strong advocates in the profession and in the sector. The voting started on May 7th, and it will go up to May 19th. And OPA will be sending, I think the first email must have already reached our OPA members, and they will have some follow-up reminder emails so that they can take the opportunity to vote. Cast your vote, support the candidate you wish to support. We are all in it together for the same reason. So, we're all here to advocate for our profession.
Yeah, and I think we had Justin on at Pharmacists, and he blasted me because I hadn't renewed my membership. I thought I was on auto renew, right? So there's an issue. So if you're listening and you think you're a member, it's the auto renew doesn't always work. And I assumed I had renewed and hadn't because it was missing some new information that they needed or whatever, and I just missed the email. So for the listeners, take the second to double check, because one of the challenges with OPA is, it's always needs the support of its membership and those dollars to advocate appropriately. And I think we're doing ourselves a huge disservice if we don't, sign up. And I'm talking to myself here because I haven't signed up this year. Because of that, I thought I was on auto renew and I wasn't, and then didn't realize that if I didn't have Justin on, I still wouldn't have known, because he went in and looked and he said, hey, you didn't sign up this year. I'm like, what the? So it's, I think it's important for us all. Just take a second, double check, make sure you're a member and cast your vote.
And I think that you brought up a very good point, John. It's not just OPA. Many of the associations are going through the same challenge. Is the membership is very stagnant, and we need to get more of our pharmacists, pharmacy professionals to be a part of their association, because the more number of people we have on the as part of the membership, the voice is louder, right? We become a unified voice when we advocate for the profession, and I think that is something everybody is struggling with. And some of the things I have heard is because I think the members look for immediate gratification. I'm paying for a membership. What am I seeing in results, right? Like they want tangible results towards their membership, and it doesn't happen. Like we already talked about advocacy being a marathon. It's not a sprint. You need to keep at it. You can't give up, and you will see the results slowly but surely. So for that, we need members to buy into this, idea of being part of your associations and continue to renew it as well every year.
For sure. And those guys looking for the quick perks too. There's a lot of them with OPA. Like they've done a good job. Like you
Yes.
have good life membership. It's super cheap. And there's a whole, I forget
Correct.
about that
Yep.
that kind of part
Insurances,
of it.
yeah.
They've negotiated for a ton of stuff for us.
Yeah.
So you get your money back through that
Yes,
if you even
that's
use a
true.
few of those services. I think we're fortunate in Toronto this year. We've got, and in Ontario, we got the World Cup coming, but we also got FIP coming.
That's
so
true.
it's a chance
In
for Ontario
Montreal, yeah.
pharmacists, to get out there,
Yeah.
showcase all the great work we've been doing.
Absolutely.
I'm sure you'll be there, and maybe we may go live to air from FIP this year as well. So maybe we get a chance to chat there about the outcome of this election.
Yeah,
and,
I know. We'll
what
see.
you're finding. Yeah.
We'll see if you guys are my lucky charm.
Yes,
go 2
yes.
for
Hopefully we
2,
can go
you
2
know?
for 2.
Oh, it
Amazing.
was fun talking to you. That's good.
Yeah, you as well. I think hopefully the audience likes this, and we tend, as we expand kind of our role, and obviously therapeutics will also always be a big part of the show, but we
Yeah.
want to get into talking to those people that are having a real impact in the profession from coast to coast. And one of the things that always kind of concerns me is we don't have harmonized scope. A Canadian Alberta or BC may get a different quality of care than
That's
a
true.
Canadian Ontario, and we
Yep.
gotta fix that. I mean, it's never made any sense to me. I talked to my colleagues in Atlantic, Alvin Tompkins, who's the chair of our shoppers group out there, and the
Yeah.
wonderful things they could do in their pharmacies right now. And
Yeah.
I think we're lagging behind. So hopefully
That's true.
part of this advocacy that you guys do gets us
Also
in line with
streamlining.
everyone else.
Absolutely.
Yeah. Yeah. Anything else, Ajit, from your perspective out in the West Coast there?
No, I mean, we're in the same boat. We're still trying to keep up our scope up to our Alberta colleagues, but it's the same thing. It's implementing what we have and then balancing that out. If you keep asking for more, obviously it has to be sustainable. So it's I feel like Smita, your rhetoric and what you're saying applies nationally, and obviously there's a lot of flux in Ontario. It's a big province, so
Yeah.
great timing to have an election because there's a lot happening, and thank you for sharing your experiences, and
Thank you
and
for
best
having
of
me.
luck. Yeah, best
Thank
of luck
you.
in the
Best of luck.
upcoming election.
Thank you so
Yeah.
much.
We'll
Appreciate
keep
it.
close ties on it. We'll see you soon, Steve.
Yeah,
Take
we'll
care.
do. Thank you so much, guys.
All right, thanks, Vita.